Well, good day to you. My name is John Gregory Downing. I am an independent insurance agent here at Texas Medicare Advisors, as well as my teammate, Rochelle Abbott. We're both licensed independent insurance agents specializing in helping people get signed up for their Medicare and then finding the right Medicare plan at the right price. As you know, looking for Medicare can get to be a little bit confusing trying to figure exactly what to do. Whether you're working with me or Rochelle, our goal is to make this as simple as possible for you and make sure you get what you need, but you don't overpay for it. Speaking of paying for it, a lot of people are concerned about how much money we're going to charge to do this for you. Well, that's the beautiful thing is our service is completely free to you. Why? Well, we're compensated by the insurance companies to help you find a plan that meets your needs and your budget. So even if you could figure out how to do this all by yourself, you are not going to save a penny and you'll probably spend more than you need to. All right, as you know, you hear a lot of crazy things and you're going to get a lot of stuff in the mail. Some things like, oh, you can get free groceries. Oh, yeah. Or those $1,000 flex cards you can spend on whatever you want. And there are also here things like, oh, you can get free rides to the doctor. Now, these are half-truths, mainly advertisements to get you to call them so they can find you something, but there are just a lot of misinformation out there. A lot of these things do not exist anymore or at a very small relative level. All right, so let's get right to it. I'm going to tell you exactly what you need to know, give you accurate information so you can make good decisions moving forward when you're signing up for Medicare. All right, so no matter what you do, you've got to have two things. You've got to have Medicare Part A and you've got to have Medicare Part B. So let's look at each one of these and see exactly what they cover and what they do. And of course, their cost. All right, Medicare Part A, that's your hospitalization coverage. So when you're admitted into a hospital, you're going to have that coverage there to take care of you. Now, the good thing is Part A is free as long as you've earned 40 credits, which equates to about 10 years of work, or if your spouse has worked 10 years, or even your ex-spouse or deceased spouse, if you didn't work and get your 10 years of credit, there's ways to get that. Okay. Now, Part A has a $1,736 deductible in 2026. So when you're admitted to the hospital, you're going to be responsible for that. All right. And now, other weird things. You got to pay for your first 3 pints of blood. Don't know how that came about, but pints of blood are expensive. And people also don't know that if you're in the hospital for an extended period of time, you have copays that can get up to $868 per day. And if you're in the hospital for more than 180 days, which would be horrible, you don't even have coverage after that. All right, so good coverage, but there's a lot of gaps in here and you could still be out of quite a bit of money. All right, let's look at Medicare Part B. Now that's for doctor visits, preventive care, ambulance services. If you get diagnosed with cancer, chemo is covered under Medicare Part B. Now, there's 3 ways to get your Medicare Part B. If you're already drawing your Social Security benefits, you get signed up automatically. You don't have to do anything other than look for your card to come in the mail. Now, if you're not drawing Social Security benefits, you are going to have to sign up for your Part B, and you're going to do this online through the Social Security website. And you've got 3 months prior, the month, 3 after. But the reality is if you know you need your Medicare, you want to get signed up 3 months prior so that they have time to process that. And again, Medicare is going to start the month you turn 65, doesn't matter what day it is. It starts at the beginning of that month. Now, if you're over 65 and you've been working and you've had company benefits, well, now you're going to sign up for your Part B during what's known as a special enrollment, and we'll talk more about that if need be, if that is your situation. Okay, so 3 ways to sign up for your Part B. Now, Part B is not free. No, the premium for 2026 standard premium is $202.90. And when I say standard, I mean that's the base. If you're a high income earner, they're going to make you pay more, and it gets ratcheted up more and more money you make. So that's the way our government is. The more you make, the more they're going to take. So if you are in a high income level, then we need to talk about that and show you exactly what your Part B premium would be if it's going to be more than 202. Now, Part B has a $283 deductible in 2026. And after that, Medicare pays 80% and you pay 20. All right, so you pay your deductible, and then if you go back to the doctor, have something done, you're going to pay 20%, they're going to pay 80%. And the problem is there's no cap on that. So if something costs $100,000, that's right, you got to pay $20,000. Okay, so while this is great too, there are gaps in here. So what most of our clients like to do is they get what is known as a Medigap plan or a Medicare supplement plan. It's the same thing. They just decided let's have two names for it to make things complicated. But we're just going to call it a Medigap plan for here. All right, what does a Medigap plan do? Well, it's going to pay for the things that Medicare would require you to pay for. For instance, your Part A deductible, it pays for that. If you have copays under your Part A hospitalization, it pays for that. Your first 3 pints of blood, it pays for that. Also pays for skilled nursing. So it takes care of all of Part A, and on Part B, it pays the 20% that you would be required under the Medicare. All right, so if you look, now the only thing that the Medigap plans don't cover is your Part B deductible, which again is $283 for 2026. And think about this, once you get your Medigap plan, and we recommend G's the most comprehensive plan you can get. Plan N is a little more cost effective in our opinion, but with both of these plans, when you get this program and you get Medicare Part A and B and a Medigap plan, you can see any doctor, hospital in the country as long as they take Medicare, and by law, you don't need a referral, and by law, they can have to take whatever Medigap plan you have. It doesn't matter whether it's Humana, Mutual, Aetna, Greg's, dirt cheap insurance, they have to take it. So this is by far the best practices of getting the care you need with the least amount of effort and having very little out of pocket, only $283. All right, well, that takes care of your stay at the hospital or your preventive care, but you know, these dang prescriptions, everybody's got to have their prescriptions. So you need to get a Medicare Part D, that's your prescription drug covers. Now these are provided by private insurance companies, but they have to follow all the government compliance rules. Okay, so let's talk about these different prescription drug options. There's been a lot of change and turmoil in the last couple of years regarding this. I'm not going to go into that now, but there are 12 different drug plans available in Texas, and they range anywhere from $0 to $167 a month, depending on your prescription. Now, how do you know what's going to be best for you? Well, the easiest way to do that is just we help you look at your prescriptions and what pharmacy you want to use, and we put those in there. We can determine, hey, these are some good plans based upon your prescriptions. And I will tell you, most of our clients are able to get by with a 0 premium plan or a $22 plan that works very well for them. It's just there's a very few people that have real expensive medications that have to have the more expensive plans. Now you may say, well, I don't even take any medications. What do I need a drug plan for? Well, you just never know. Plus, if you don't get one and then you want to get one later, you're going to pay a penalty for the rest of your life. So just get a low-cost plan. If you don't have it, get a 0 premium plan. It's a no-brainer, okay? So that gets you fixed up on your Medicare prescription drug plans, and we will help you with that. Now, Medicare doesn't cover everything. As you can tell, this fellow right here probably needs a little dental work. But Medicare's not going to pay for that. So if you need those type things like vision is not covered, hearing's not covered, those are additional coverages you'll have to get and pay for on your own. One other thing I highly recommend is you look at some supplemental cancer insurance. Well, Greg, doesn't Medicare pay for cancer coverage? Yes, they cover that, but what I've seen happen is a number of my clients are on these very expensive cancer medications that are $7,000, $8,000, and even with the drug plan, you're going to pay a lot for those. And not only on top of that, there's a lot of hidden costs associated with cancer treatments. I've got a client that lives in Marble Falls. He has to travel to Round Rock 4 times a week for his treatments. And guess what? He can't drive himself there and back when he gets those treatments. So there's just a lot of travel. If you got to go to MD Anderson, then I just recommend you have some. I have $20,000 on me and my wife because on her side of the family, her dad, mom, and brother have died from cancer, and both of her sisters have had breast cancer. And on my side of the family, my dad, my mom, my brother have had cancer. I mean, it's just too rampant, and it's a horrible disease. And I just recommend if you want to spend some money, that's a good place to put that. All right, the other thing that Medicare doesn't cover is long-term care. Now, this is not something you have to do right now, but you're going to need to figure out some solutions for your long-term care. This is my dad. He made it to 92, lived with us, me and my wife, for almost 3.5 years. And prior to that, he was with Mom at Red Raider Ranch in Lubbock, Texas. They were there for about 3.5 years at that assisted living place. And that costs a lot of money. So I'm just saying you might want to talk to me about looking at different ways to hedge on some of those long-term care costs, because if you don't have anything in place, you're going to be paying a lot of money. The reality is 70% of us are going to need some type of long-term care once we hit 65. So that's something we don't have to do right now, but something to think about that we like to communicate options for that. All right, let's see. Where are we? All right, we need to do 6 things right here. Don't ask me how that happened, but moving on. You got to get your Medicare Part A, you got to get your Medicare Part B, and you need a Medigap plan, either N or G, either one of those works fine. And you need a prescription drug plan. And you need any additional coverages, well, we can help you get set up with that. And you need to start thinking a little bit about your long-term care planning and needs in the future. Now, I'm just going to tell you, when you do 1, 2, 3, and 4, this is all going to run about $350. Varies on several things, but you're already paying $202 for your Part B, and you get a drug plan, Medigap plan. So you need to budget about $350, $400 a month to get all these things, and that's just how much things cost right now. Well, I know not everybody can afford that, and some people are on a very tight budget. They're on a fixed income, and that's just a lot of money to ask for every month. So what we might need to do is look at a Medicare Advantage plan. Now, Medicare Advantage plan is where the government's, wow, my goodness, we got all these people turning 65, and they're living forever. I think we could probably save some money and contract this out to private insurance company. So what they do is they call this a Medicare Advantage or Medicare Part C. There's another thing, the same thing's got 2 names just to keep us on our toes. So companies like Aetna, Humana, United Healthcare, blah, 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 they all contract with Medicare. Medicare pays them a fixed amount per month per individual they enroll in their Medicare plans. Now, what are good about these? Well, you just need to have to pay your Part B premium. Of course, you're going to have Part A. And a lot of these plans don't have additional premium. Some of them do. Some of them have a 0 premium. And the good thing is they include a prescription drug plan. They've got a little dental, a little bit of vision in there. But, they're managed care. So if you have to be either in a PPO, an HMO, and there's good and bad things about a Medicare Advantage plan, and if you get really sick, you could be out of pocket quite a bit of money, but there's still a solution for many people, and if you just do your research on that, and if you want to get more information on that, we can certainly do that for you. We have a lot of people on those programs. Okay, what now? Well, you need to complete the scope of appointment form. This is a government form that we have to get everybody to fill out and give us permission to help you. All right, and in there we're going to need stuff like your home address, what medications you're taking, what doctors you want to see, what hospitals. That way we can make sure and get the proper plan for you. And then once that form is completed, then we can get back with you and go, okay, review things, and then we'll put together a customized cost analysis, moving to Medicare based upon what you want. And then after that, and you got clarity on everything and you know what you want to do, then we're going to get you all set up, signed up on what plan is going to be best for you. It's that simple. Now, we're here to make this as easy as possible so you don't, go crazy and make your hair turn blue. If you just follow what we suggest and work with us, we're going to make this as easy as possible, and everybody's going to come out and be happy. So get back with myself as soon as you can, or Rochelle, whoever you're working with, and we look forward to helping you transition to Medicare with the lowest, easiest possible cost we can.